Who's excited about breakfast? Hello everybody. So, so you can see I just bottle fed Cindy Lou, Cindy Lou, and I thought that it would be nice for her to have some mama time just between now and the next feeding. So I thought I would attempt to distract mom with the food, with breakfast delivery, and then stealth insert a kitten. So sort of worked. So we'll see. Hopefully she'll get a little bit of snuggle time, and then I'll go collect her around 12:30. And then I'll probably take all 4 kittens and we'll do weigh-ins and stuff like that. You can see there's quite a size difference developing. Let me check out the top view on the VIP cam for a second. So, as far as Cindy Lou goes, she is, as you can see, still with us, which is good. Her condition hasn't necessarily improved too much. Her weight is hanging pretty steady. Still in the, she was 107 when Gwen dropped her off this morning around 8, and so her feeding at that point. She started off at about 107, went up to about 111, so and then was back down to 108 when I did her 10 o'clock feeding, so her 10:15 or so feeding. But mommy's giving her a bath now. That's nice. I just think it's gotta be good for her to get some time with mom and siblings. I wish I could plunk her in there in between every feeding, but I think I have to be really careful not to make it too stressful for Sable. But if at any point Cindy Lou is strong enough to return to Mama, I want them to be able to maintain the bond as much as possible. And Sable's such a good mommy that I'm not super worried about it. And as you can see, she's I mean, I do potty duties, but I feel like Mom does a much better job. So, and Cindy Lou has been giving us lots of peas and lots of nice poops, which is good. I don't expect her to do any nursing, but I just wanted her to be able to get some snuggles from Mommy and with her siblings. It's always hard when you have just one. I mean, Frank can only go so far. Frank and Snuggle Mom and human snuggles. We've been giving lots of human snuggles, so she definitely has been surrounded with lots of love, and she's been purring. She purred after I fed her this morning, for the first time purring for me. She probably purred for Gwen overnight, but she purred both at the 8 o'clock and the 10 o'clock feeding, so that's pretty cute. She does seem to be a bit more, have a bit more energy today than yesterday. You can see she's still slightly directionally challenged, but Mommy's eating her breakfast, so at least, she may have an abnormality in her respiratory system, and it may not be something that will give her a long life, but at least whatever life she does have, she is very comfortable, and she knows that she's loved, and she's not in any pain or anything like that. So if her condition worsens and she is at a point where she's not having a comfortable existence, then we'll have to make the right decision for her. But as of this moment, she is hanging in there, and so that's kind of the best we can hope for. It doesn't mean she's definitely not out of the woods, not even close to being out of the woods. So she's not gaining weight, etc. But we are doing everything we possibly can do for her. And I mean, you guys saw with her not nursing at all, she definitely would not have survived 24 hours if she had been born at the colony. So we know that it would have been over for her by now. So at least she's warm and she's safe and she's comfortable, and just for as long as she has. I don't know that we will ever, or maybe not ever, but I don't know that we will be able to have a diagnosis. We've seen, especially with these colony cats, so many strange, inexplicable things that it's really difficult to diagnose, because vets never see stuff like this. And also because she's so teeny tiny, we can't do, ultrasound, for example. The ultrasound probe is like the size of half of her body. They did the x-ray on the mouse setting because she's so tiny. So we've done everything we can to try to rule things out. So like her heart is healthy, her lungs are healthy. She has 2 kidneys, she has a liver, you know, everything that can be assessed has been assessed, but being so tiny, and you know, there's just an unlimited number of things that could be different about just the way her systems are working. So we just don't have any way to know. And if it's an abnormality, there's really nothing you can test for. And you know, unfortunately at this point there's also really no way to know if, you know, what her long-term prognosis might be, if this is something that would grow with her or something she might grow out of. It's just impossible to say at this point. So I know that's tough to hear. It's tough for me, and you know, it's tough on all of us to not have an answer. But all we can do is just take it like 1 minute at a time and be happy for this minute. That's a good minute for her. And she's in there with her little friends and her mom's taking care of her, and that's where she should be. So I'm hoping that it's not a mistake putting her back in there, because I think it will probably be a challenge getting her back out. But I wanted her to get some comfort from her family, and I think that will be good for her also. So, but don't be alarmed if she doesn't nurse. I don't expect her to. She just ate about 5 milliliters from the bottle, which is a huge meal for her, and she ate it within probably 5 minutes, which is a pretty good sign also. I didn't have to really like work on getting it into her. So you know, some encouraging signs, but not like, she's certainly not at the level her siblings are. And there's definitely something more going on than just her being small. And you'll notice though that her feet are very improved. We've been doing stretches, and if there's one thing I know, it's back leg physical therapy. So I think that's been pretty effective. Her feet are looking really good. So I don't know, for this moment in time, after a full night's sleep thanks to Gwen, I'm feeling a bit better than I was yesterday. So I thought you guys might like to see her. And I have to say how incredibly grateful I am to Gwen for basically coming in, and she's so competent, she's so experienced with teeny tiny kittens like this. And so I was able to sleep for the first night in, like, I don't know, over a week, which I really needed to do to be less like incoherent and irrational and weepy. It was kind of a disaster yesterday. So I'm super grateful to Gwen for that, and also for all the snugglers have been wonderful with No Elf and taking care of them, making sure that they're not neglected in any of this. So I think, so poor Gwen has her day job that she's at right now, and she said that she would come this evening and do the overnight shift for Cindy Lou Mew tonight, which is amazing. So that's super helpful. She did tube feeding overnight, just to make sure that Cindy Lou Mew was getting the right amount of calories, which is great. Tube feeding is really great when you want to make sure that they're getting enough to eat. And so she did tube feed every 2 hours, and so I've switched back to the bottle feeding, because it does take more time, but just to give her a little break from the tube. And she did eat very well both at the 8 o'clock and the 10 o'clock feeding. So she's had 1 poop today, 2 pees. I forgot to weigh her after her 10 o'clock feeding because I was so eager to get her back in with her mom quick. Yeah, so we weren't sure. We were very careful with the first tube feeding. It's something you have to make sure that you place the tube properly, and we weren't sure with her anomaly whether the tube would work. And so what you can do is use something like sterile saline and just push a tiny drop of that through the tube when you get it placed, and then if it's in the wrong place, she'll cough, but she'll have just sterile saline in her lungs, and which can be absorbed by the body and won't cause a problem. So you do that first to make sure that the tube is placed properly and there's not an issue, and then you push the formula, and that way it's as safe as possible. Yeah, so it may just take her a couple of days for her body to work a little bit better, for her to grow a little bit, and her to develop a little bit. And we'll keep feeding her every 2 hours, and just continue to hope for the best. Dr. Ferguson does think that there is an abnormality in her respiratory system. She has sort of makes a click sound, which is most often associated with when she inhales and exhales, but also happens other times. So it's quite unusual, and not something that any of us have ever seen before, or probably that really any vet has seen before, because these guys have such interesting things. And normally, if a breeder had a kitten that was doing that, they would euthanize. If she'd been born in the wild, she wouldn't have survived. So it's very unusual that they see things like this in neonatal kittens, because they often, well, almost always do not survive. So so we'll just have to see how things go, and hopefully you guys can all, I hope it's not too hard to see her in and out and all this, but I've been going through the stages of grief or whatever, because I was so worried about her yesterday and overnight. But I think just hopefully we can all take some comfort knowing that her life is the best that it would have been, and we may not have her with us for as long as we would like, but all she will ever know is love and comfort and warmth, and sometimes that's the best we can do. And so nature can be cruel sometimes, but we're at least able to take the cruel part out of it and just help. It's sad for us, but for her, it's just, she has a good life for as long as she has. So we'll see. But as you can see, though, the other 3 kittens are doing amazingly well. They're like just fat and great at the milk bar and active and totally healthy. So I have no concerns about them, which is really wonderful. Sable is an incredible mom. She's doing such a great job. We're all really fortunate that she is accepting Cindy Lou back in whenever she comes back in. She's just such a good mom like that. And so if she was a friendly mom, I would be able to just sit in there and hold Cindy Lou up and let her nurse, and that would be the ideal outcome. Or if I had a friendly mom here like I did last time around, if it was Tip, I think that we would probably be in slightly better shape, but this is the best possible scenario for the cards we've been dealt. So so we are doing everything that can possibly be done, and really all we can do is provide the very best supportive care, and the rest of it is up to her little body to see if she can work out the kinks or not. But I do feel that she's a bit stronger today than she was yesterday. I'm not as worried. She would still have the abnormality even if she was nursing, but if it was a tame mom, I would be able to hold her up on the nipple until she was able to nurse enough. And then she would probably need less supplementation. That would be the benefit there. Like I did with Eep and with like Munchkin. Munchkin from Dorothy's litter needed to be bottle fed because she was also born very tiny and wasn't quite strong enough to compete with her gigantic brothers for the first week or so. And so I did a combination of supplementing with the bottle and also just holding her up and blocking her nipples so she could actually have a good meal. She is capable of nursing because she nurses on the bottle. I think initially with her curled feet, she wasn't able to get in position and hold herself in position. And then I think she became weak from that. And then whatever else is going on, she was having a really difficult time finding the nipple. And then if she did get latched on, she just wasn't able to stay on. And now that she's used to the bottle, she may or may not be able to transition back and forth to a real nipple versus a bottle nipple because they are different. So I wouldn't necessarily expect to see her latching on at this point. And you can see she's just snuggled up there. She's doing what Marvy used to do. Marvy was very good at looking like he was attached at the milk bar, but really he was just copying his brothers and sisters. I don't think there is another friendly mom around, but I'm hoping that, I mean, worst case scenario, if we have to bottle feed her for the duration, it would be 4 to 5 weeks. And as she gets older, once she gets past about 2 weeks, then she can eat larger meals slightly less frequently. So right now we're feeding every 2 hours around the clock. But you know, as she gets older, she can go 4 hours between meals, and she may at some point get strong enough to be able to latch on by herself, you know, if we get to that point. But for now, we're still taking it 1 minute, 1 hour at a time. They're so fragile at this stage. It's just hard to predict what's going to happen. So yeah, so kittens are born blind and deaf, so the way they navigate is by smell and instinct. She would still need a lot of extra care even if there was a friendly mom around. So it's not like I couldn't just hand her off to a friendly mom and just have that be that. It would still be a situation where she needs to be monitored pretty much around the clock, at least for now. She's well hydrated. She doesn't need fluids. She is getting a lot of nourishment with the bottle feeding and the tube feeding, so we're in good shape there. Oh, really? You're not seeing the VIP? Let me see. Okay, I'll do a reset over here. Because it says it's streaming, but I will do a reset. Oh, let me check. Okay, try VIP again. Okay, I think VIP's back up. Sorry about that, guys. My brain fog yesterday seems to have infected the equipment. You guys can really see how her feet are looking so much better, though. Right now, you can see a good view. It's nice that I can at least deliver Sable to breakfast in bed and she doesn't completely go Yeti feral on me. So I think we can all just have like a breathe a little sigh of relief at least for the next hour. So I'll be going in around 12:30 to try to scoop all 4 kittens and do weigh-ins, and then I'm probably going to keep Cindy Lou out here because I think that if I have to go in and chase Sable off the nest every 2 hours, I think that will be too stressful for her. I think doing it a couple times a day is, maybe okay, but while it feels like they've been born for a week, it's only been 2 days. And Sable's a great mom, but I don't want to push my luck with her. Now, if this was Savina and Savina's babies, there would be no way that I could bring kittens in and out, I don't think. I think that's going to be I'm just going to have to let her do her thing. I don't know how that will go, but we'll figure it out when the time comes. Luckily, we've got a few weeks to get these guys going. And hopefully by the time, hopefully we'll have everyone stable in the stable nest, and then we'll have 2 more litters. So it's going to be interesting. I did post a video of the miracle kitten doing his purrs and biscuits last night in bed. There's no picture because it was so dark, but you can hear the miracle purrs. It's on Tiny Tuxies on Facebook.